welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's top headlines. Original certificates are doctors' property. Medical colleges have no authority to retain documents. In a landmark ruling, the Odisha High Court has pronounced that the original certificates are the assets of the persons concerned and directed MKCG Medical College and Controller of Examinations, Berhampur University, to expeditiously release the original certificates and mark sheets of doctors withheld since their admission to PG courses. The decision comes in light of the policy's decision taken by the state to keep the certificates of the doctors till they complete their mandatory 2 years bond service. Justice A.K. Mohapatra, presiding over a long judge bench, emphatically stated that the concerned institutions do not possess the authority to retain doctors' original certificate without any legal basis, solely relying on executive decisions. The matter revolved around the policy implemented by the government of Odisha, which aimed to withhold doctors' original certificates until they fulfill their mandatory 2-year service, as per the commitment they made through a bond. Subsequently, all PG students are required to sign an agreement pledging this 2-year service. Doctors revive unresponsive baby on Bengaluru-Delhi flight. A 1.5-year-old girl on a Bengaluru-Delhi Vistara flight stopped breathing, but her life was miraculously saved by 5 doctors who were on the same flight returning from a medical conference. The distress call was made by the crew about 30 minutes after takeoff. 4 senior residents from AIIMS and 1 doctor from the Institute of Liver and Biliary Sciences responded to the situation. The child appeared cyanotic, indicating a lack of oxygen in the blood. The doctors, who were returning from an Indian Society for Vascular and International Radiology conference in Mumbai, performed life-saving measures including maintaining the child's airway, using positive pressure ventilation with an improvised face mask and pediatric airway device, and administering CPR according to pediatric life support guidelines. Despite the limited availability of necessary equipment, the doctor secured an IV line, administered emergency drugs, and utilized an onboard automated external defibrillator to restore the child's heartbeat. After 45 minutes of CPR, the child's pulse was palpable. Due to the absence of ECG and oxygen saturation monitoring tools, the pilot was instructed to land at the nearest airport in Nagpur, where the child was handed over to a waiting pediatrician with stable vital signs, which had departed from Bangalore at 9 p.m. and was scheduled to land at Delhi airport at 11:45 p.m. The doctors who were involved were Dr. Navdeep Kaur, Dr. Ashika Chakravarti, Dr. Avichala, Dr. Damandeep Singh, and Dr. Rishabh Jain from ILB. Violence, overwork, mismanagement of patients, non-availability of medicines. IHBAS doctors to go on strike, warn of complete shutdown. Resident doctors affiliated with the Institute of Human Behavior and Allied Sciences in Delhi have announced a strike. They have raised pressing issues related to patient care and the working conditions of resident doctors at the institute. In a letter addressed to the IHBAS director, the Institute Resident Doctors Association highlighted multiple challenges faced by both doctors and patients. These issues encompass difficulties experienced by resident doctors during emergency duties, mismanagement of patients in the OPD, shortages of essential medications, inconsistent recruitment of non-academic junior and senior residents, and salary disparities. Starting from today, the resident doctors will cease their participation in OPD and ward services while maintaining emergency and ICU services. However, if the concerns raised by the RDA remain unaddressed, the doctors plan to suspend their emergency services from 1st of September. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.